just to introduce Aaliya, who's kindly agreed to present today despite being on a set of nights. We really appreciate her being here to share her insights into applying into core surgical training. And the reason why we've asked Dr. Aaliya to speak is because she's already achieved so much, and will be a great source of inspiration to you all out there. It's hard enough to get into surgical training, being a female as well as being an IMG doctor. And not only has she got into surgery, she's managed to secure a training place in plastics in Wales as well. So that speaks volumes in itself. And also, speaking about Dr. Aaliya, she's also the founder of the Surgical Society of International Doctors. So she has lots of information to share with you. So without further ado, I'll hand it over to Dr. Aaliya. Thank you, Aaliya.
Oh, thank you so much for such a lovely introduction, and thank you to both of you for this opportunity. This is so impressive, and I'm sure so many doctors and medical students everywhere have gained so much from this conference. I'm Dr. Aaliya Uddin, and I'm a core surgical trainee in plastics in Wales. And today I'm just going to be talking about my experience in getting into surgery and surgery in the UK. Different audience today, from medical students in different countries to doctors who are already halfway or in the process of getting into surgical training in the UK. I'm not going to concentrate on the application process that much. We'll just rush through it, but I'd like to talk more about my experience of this whole journey of coming from my country to the UK, just so that I can inspire a few of you guys, hopefully. So I'll be talking about my journey and then surgery and life in surgery in the UK, and quickly through the application process. So I come from India, and that picture on the left is where I grew up in Mumbai, in a small place called Malad. And I did not always want to do medicine. I think I was more into getting into a creative field like fashion designing or interior designing. But as Asian parents go, my mom really wanted me to be a doctor. So I joined the medical school. That's the picture of my medical school on the right. And it was great. And I think in my second year is when I realized that I think I want to do surgery, which is quite early on. And I felt like it was very, very close to it connected the creative side of me to medicine, and that's why I wanted to do surgery. And I knew very early on that I wanted to go abroad as well, because I had cousins who lived in the US, and it was very fascinating growing up. But I was always confused as to where to go, US, back in India. And I'm sure many of you guys out there are confused with that question as well. And I just took a leap of faith, just said, okay, let's try UK. Didn't have any family, didn't know anything about the UK, and we'll see how it goes. And when I thought of coming to the UK, when I started at the end of med school, that is how my CV looked like. I didn't have any exams. I was straight out of MBBS. Not have any research experience. I just had a small local leadership post in my college. I had done some teaching, but did not really know what evidence was at that point. And audits, I mean, who knows about audits outside of the UK? I had not heard about it till I moved to the UK. So that's where I started, and this was in 2018. And I didn't know anything about the UK system. I didn't know anyone in the UK. I gave my PLAB exams in November 2018, gave my PLAB 2 in March 2019, moved to the UK in 2020, got a Gen Surg job as a non-trainee, and that was December 2019 actually. And I did 2 years of working in the UK in a non-training post. So from December 19 to August 2021, I did Gen Surg teaching and ITU. And in that time is where I built my CV, where I learned about the system and applied for core surgical training. And I got through in 2021, this year, August, and I've started my core training in Wales. It was a lot of hard work and a lot of dedication and consistency, which I feel like which allowed me to get into core surgical training, because you're competing in this application process with UK trainees who know the system from their first year of med school, and who especially doctors who want to get into surgery know early on and start preparing towards this application process early on in their med school. Whereas if you're from a different country and if you don't know the system, you join that race quite later on, and that's what I felt. And since I've moved to the UK, I've made lots of different attempts to help other trainees in different countries to just understand the system. As a little bit, you'll do a little bit, and so when you do come to the UK, you won't be starting from scratch like I did. Um, and even though you are already in the UK and you're starting from scratch, it is possible. I did it, and if I did it, I think anyone else can do it as well. Um, so there's lots and lots of information out there. It's just about looking for it and going through it and making small efforts every day. Um, so that was my journey. I'll just talk about the training structure now in surgery. It's very similar to other specialty training structures, so I'm sure other talks would have covered a little bit of it. There may be a bit of repetition, but for surgery, um, looks something like this. So you do your medical school, from, and then you do foundation training. In the UK, it's for 2 years. If you're in your own country, it may be, in my country, in India, it was 1 year of internship, and then I did 1 year of a non-training equivalent of foundation training, year two in the UK. And that salary range is somewhere from 28 to 32,000, with on-call supplements. And then you apply for surgical training at that point. So the applications open in November, and your year starts in August. And then you do 2 years of core training. That's year one and year two. And I'm in year one right now. And that's the basic salary in England for that. And core training is quite hectic, I have to say. You have your expectations are quite high, the time is quite less, and you're working a lot. And in that whole environment, you also are expected to apply to prepare and apply for your ST3, which is what you eventually want to get into, which is a specialty training, and that will be in the field of your choice. But during a core training, you can get into a specialty of your choice and develop towards your ST3 application better. um, and then you do 6 years from ST3 to ST8, depending on your specialty. Some specialties are 5 years, like urology is 5 years instead of six. And also in most specialties, especially in surgery, you are expected to do a fellowship. Most people would do a fellowship somewhere in the specialty training, or do a PhD, which would add up a couple of years, and then eventually you become a consultant. So it's a long journey. It's give or take 10 years if you go whoosh, 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 straight in at every attempt. Um, but I guess, as you can see, at every point you're progressing, your salary keeps increasing. Every year you're going a step forward. So it's like doing any other job. And it's it's not like, oh, it's going to take me 10 years as compared to it's going to only take me 3 years in my own country. It's more to do with, at the end, when you become a consultant, that's the highest level you reach. Whereas in other countries, you finish your residency and you work as a specialist doctor for a couple of years before you become a consultant. um, yeah. And the training is quite can be quite hectic. There's lots of on calls and nights and out of and outside of your work you're expected to do research and teaching, um, but it's worth it in the end. In the end, when you um, I like just getting into core training and just being 4 months into it, I'm doing one rotation and moving on to the other one. I feel like I've learned so much. um, yeah. So in the UK, how is surgery different? Um, we follow a lot of evidence-based medicine. There's lots of research happening and lots of technological advances. There's lots of robotic surgery. Um, if you get a job in a tertiary center, there's lots of advanced procedures that you wouldn't see elsewhere. Um, the training is standardized, so you every year you're expected to do a number of cases, and your supervisor is supposed to support you in that. So it's not like, okay, you have a good supervisor, so you get to do a lot of cases, and someone else doesn't have a nice supervisor and they suffer. But the training is standardized such that every trainee gets the right opportunities, and they make sure that you learn the number of cases that you're supposed to, and you're able to operate at the level that you're supposed to, which is quite nice. And also, it's not, I feel like in the UK it's a holistic approach. You learn you learn about everything. It's not only about learning the surgical skills, it's about learning about your ward care. How do you manage an acutely unwell patient, and um, how do you like the medicine part of surgery as well, which sometimes you may not learn as well in other countries. And there's lots and lots of research opportunities, especially if you're in a teaching hospital. There's lots and lots of research happening if you're interested in that. um, Another thing in UK, exams and are a test of competence and not a test of excellence, which is something I could compare to US. When I was thinking of applying to US or UK. In US, you had to get the best rank and the best score, whereas in the UK, you need to be having the competency that they expect you to have. It's not about your rank; it's just about attaining that level of competency. And I think practicing medicine in the UK, as I've only worked in India and the UK. I can only compare the two. I can't speak for other countries, but from what I've spoken to other people, I think it makes you an all-rounder. It like my communication skills have improved massively. You learn how to work in a team. You learn how to be a good leader, a good teacher, a good mentor. You develop patience, and you work with so many different people and so many different teams. um, you inspire your juniors, and you develop this resilience and this strength to work towards your goals. And I think it, as an individual, it it really helps you grow. I feel like I've grown so much in the last 2 years, and I've got so many more years to go. So it's not only about your surgical skills. And there's lots of opportunities eventually later on in your career. Once you become a consultant, you can work in the NHS, you can have a private practice, you can get into medical education or research, or you can get into the hospital management section, you can do humanitarian work. You can go and work in different countries if that's what you want. If you can go back to your own country, if they accept the qualification. So like the possibilities are endless. And also, um, I'd say life in the UK is um, is nice because the pay is decent. You have a good standard of living. If you love traveling, it's really close to Europe. Um, there's it is so diverse, and you in every hospital that you go, you will find people from everywhere in the world, which is amazing to meet people from all these different countries. And you get lots of leaves. You get 27 annual leaves. You get study leaves and sick leaves. Obviously, you're away from home, um, but out of my experience, I'd say life in the UK is quite good. In surgery, my typical week um, would of any surgical trainee would look somewhere similar to this. So um, you get some experience in elective theatre, you get some experience in emergency theatre, you do on calls, then you go and cover wards, do clinics and elective and emergency clinics, and then you have your blocks of night shifts. So normal days would start at 7:30 or 8, depending on your department, to 4 or 5 o'clock, and you work in different teams. And whereas your on calls and nights would be 12-hour shifts, and those are the times when you deal with patients coming in through the A&E and you hold the bleed, and there's lots of learning opportunities there. Yeah, sometimes it can get quite hectic. Like I've done 4 days of Monday to Thursday I've worked, and then I'm doing nights Friday, Saturday, Sunday. So yeah, it can be quite hectic. But as compared to my job back in India, I used to do 72 hours in 4 days. So this is a dream. So I want to talk a little bit about portfolio, and um, I think I don't want to go into detail because there's lots of information available online now. I feel like when I was moving to the UK, I couldn't find a lot of information, but now there's lots and lots available. Best place to go, especially now, right now, because it's November, go on www.oriel.nhs.uk. On that, you can find the application and find the scoring system, and you can find what they're looking for. And it keeps changing every year, but they're sort of very on the similar background, but they keep changing it every year. Um, Also, nothing is impossible if you work hard, if you're consistent, if you know what you want, and if you play smart. uh, Everything is achievable. When I was moving to the UK, I'm sure lots of people must have experienced the same thing. Everyone says, oh, surgery is impossible, you can't go to another like Western country and get into surgery, it's almost impossible. And then when it came to, oh, plastic surgery, that is just absolutely impossible, you should be more realistic with your dreams. And well, I'd say, just if you know what you want, then you should just work hard towards it. CST application, like any other specialty application, has portfolio section and interview section. Um, Portfolio usually counts for 1/3, and your interview counts for the 2/3 of it. Um, it. For the portfolio, there are a few things that I wish I knew before moving to the UK. And I think there are things, if you're a medical student back in your country, there's so many things that you can work on starting now if you know you want to come to the UK. And that would help you so much. And even if you're not a medical student but you're working in your own country, um, I'd say the first step and the first thing to know is evidence. Just collect evidence. If it's not documented, it did not happen. That's the motto in the UK. So you need to have evidence for everything that you do. And we don't have that practice back in our countries. We don't really collect any evidence for anything. But over here, if you've done if you're teaching someone, you should collect a feedback for that. If you've presented something, keep that certificate safely. If you're doing some research, have all the paperwork together. Whatever cases you go in your internship or during your medical school, you go to theater or you go see something interesting on the ward, you log that together. In the UK, we obviously have a proper system of, like, we have a logbook where we put everything in, but you can get access to the logbook once you have GMC registration. But if you don't, just make an Excel sheet of your own and just start putting your details of all the cases. Um, and because I think that's if you take anything from this talk, that would be the biggest advice I'd give. Just collect evidence for everything you do. Once you come to the UK, you can all put it together. But if you don't collect the evidence, you just waste all the things that you've done back in your country. Um, Also, research and audits. Read about audits. There's lots of information online about what an audit is, and it's quite doable in your own country. if you're a medical student, it's very much doable in your hospital. And not only for the purpose of coming to the UK. I think audits are such a great thing that if we could bring that culture back to our own countries, it would improve our healthcare as well. um, and start small with research. Maybe think about a case report. And there's so much time in med school, I feel. And I feel like if I was really motivated at that time, I would have started something. So go approach your professor, uh, or approach a resident who's interested in research, and just say you want to do something, and start small, but start soon. So the portfolio usually has a total score of 72, and I think I've got only 5 more minutes to talk. So I'm going to quickly go through the application, but the application system is there online. You can find it easily on Google. Um, what I did was um, just make a printout. So there's a self-assessment scoring system. Get a printout of that. See where you stand. Calculate your score. Okay, today I stand at 10 points out of 72. And then see what you can do in the next coming years to increase your score. Because if you don't look at it now, you're going to be coming close to the application and be like, oh, now what do I do? It's not going to, it takes time. You're not going to be able to get all the points in 1 month. So get a printout of that, sit down and calculate your score, and then see what you can do to improve it. So they look at sections like commitment to specialty. So they look at your MRCS exam. Have you attended any surgical courses? How much experience you have? That means the number of operations you've attended. So that's why the surgical logbook. And things like taste weeks and elective. Then they look at degrees. This section is something that I would not concentrate on. If you have it, you have it. If you don't worry about it. I did not have any degrees. Um, Prizes and distinctions are other things. So participate in various competitions and present as much as you can. Um, Audits I already spoke about. These are an important thing in the UK. If you can read about it, do that and try and start working on it early on. But if you don't, it's fine, completely okay. You can come to the UK and do it as well. Teaching is another thing that everyone presses a lot on. So if you do any teaching, I'm sure everyone does teaching in their own practice. Just collect feedback for that. And attend various teaching courses. That's another thing on the portfolio. And presentations. So all the projects that you do, there's lots of conferences happening. Just Google what conference is coming up next, when's the deadline, and submit your projects and present. And work on research and leadership. Leadership is another thing that takes a long time to get into. Start small, start locally, but try. There's lots of different committees which keep advertising leadership opportunities and committee applications. Try applying for them. Some general tips: consistency, start early and do a little bit every day. Have some goals and try to achieve them. And always remember that your journey is unique. You may be coming straight after MBBS, or you may be really later on in your career, and you may be a consultant back in your country and coming to the UK. Everyone's journey is unique, but UK has that opportunity for everyone to come in at different stages, which is actually great. And I 2 years ago, I did not think I would be where I am today. And I feel from where I started, this is where I live now, and this is where I work. Um, I've met some amazing colleagues and improved a lot as a surgeon, I would say. Had some amazing opportunities to present and get involved in research, and also travel so much being in the UK, and Europe being so close by. So I think not only in medicine, I think just as um, in my life, I feel like I've grown so much in the last 2 years just because of the opportunities I've received in the UK. So definitely, it's possible. It's possible to get into plastic surgery. And if you do want any advice, any questions, you can always get in touch with me. Thank you so much. So just on the screen, that's my email address. And I also have a page, the IMG Mentor. So you can follow me on Instagram or Facebook as well. And that's a website for the Surgical Society of International Doctors. We have lots of opportunities for everyone in the same boat. Was this society was started just because of having that experience of going through this and helping other people um, going who want to get into surgery in the UK. So yeah, thank you so much. I hope you like my talk.
Thank you, Ali. That was brilliant. Absolutely brilliant. Really, really good. Simple, to the point, but full of your own story and full of, yeah, just really inspirational things that hopefully a lot of docs can take away. And because surgery, as you said, surgery, people are often put off before they've even thought about it. You know, it's almost, well, it's impossible, and you know, do something else, and you never get a chance. Competition is so high, and to hear these kind of stories, I think is so important for people, and just to see that it can be done, and you know, just a bit of hard work, and you know, and as you said yourself, it's not like you'd been planning for this since you were born. Like, you know, you didn't. You said that when you finished med school, you didn't really have anything on your CV that was surgical related, and it shows that even if you made that decision fairly late, you can still do it if you plan and do the right things and you're methodical. It works.
Yeah.
Which is really good.
Thanks so much.
And I know you've had a tough week as well, not just with nights, but with vehicle incidents and stuff. So I hope
Yeah,
everything.
so I've managed to drive my car into a pole and break my car down. My phone decides to die the same day. My laptop was damaged in the incident. So yeah, I've been having a rough, and I'm on nights. So to top it off,
And thank you. So you're doing night tonight?
yeah, yeah.
Okay, wow. So you need to go and get some rest. We've had a lot, and this is the most amount of questions we've had actually in the whole conference is for you, for your talk. Lots of inspirational comments going. Thank you so much. Very inspired. You know, your journey is incredible. Loads of nice stuff, and we'll send that all across to you because it's really important that you read that and see that. But there are a few questions that will be quite useful to answer if you mind us just pinging them across to you on the chat system here. So that we could jump onto the next one so that people aren't waiting. But I'd love to send them to you because they're really helpful, and I think you can do more. There's a couple, Pooja, there's a couple of questions that repeated. If you want to just jump in and try and do one or two before we move on that are more general.
Yeah.
Yeah, lots of questions have come in, as Aman has said. So thank you, Aaliya. As Aman said, really useful, and we appreciate it despite your crazy week this week.
How are non-training jobs in general surgery? I guess it does vary from place to place, but in general.
Yeah, I think it does vary from place to place. But if you really show an interest in surgery and if you show that you're keen, there's not that much difference between a surgical or a non-surgical job in itself. In career progression, obviously, it's better to be in training, but the opportunities that you would get is the same because you're on the same rota, you're doing the same role. It's just about showing them that you're as keen as the trainee, and people really recognize that. If you show that you're keen, they will be interested.
Yeah.
Bro, so Aaliya, someone's asked, what's the right time to appear for MRCS?
If you're sure that you want to do surgery, then I would say as early as you can. The earlier the better because you have to do it at some point. And if you think you're confident enough to give it early on, I would say give it early on. Like I know people who finish both their MRCS before getting into co-training, and there's at such a good advantage of having that done, and so they can concentrate on the job itself and other things.
Bro.
I didn't realize people complete both parts before even starting training. That's crazy. That's very good planning. And one last question before we start swinging them across to you. How difficult is it to balance personal life versus a tough surgical job? And then also, do you get hands-on at the foundation level?
So with the first question, managing personal life and surgery can be quite difficult. You have to be organized because you have some time off and you want to do something, you should have planned for it beforehand and try to sort of swap. Everyone's very friendly. If you have things coming up, then people are happy to swap. But it's not easy. I'm not going to say it's easy. It's quite tough. And you do a lot of weekends, and you at the end of the day, so many times I've been meaning to go to the gym, but you're just tired and you're just like, okay, maybe tomorrow, maybe tomorrow. Yeah. And the second question was about getting hands-on experience
Yeah.
in foundation year. Again, it depends on how much experience you already have. um, if you go to theater and they can see that you can do things, then they'll give you a bit more the next time. But everyone's keen to teach. um, it's a very standardized situation in theaters. If it's not, I would say it's quite difficult at a foundation level to get a lot of theater experience. But if you do go in, and if you're keen, and if someone appreciates that you can do quite a few things, then they'll let you do more.
Yeah, I think you hit the nail on the head when you said if you're keen and you're enthusiastic and you show you want to, people are there to help, right? People are there to give you up to your competency level. They're probably going to let you do as much as you can. But you've got to take that initiative. Really great. I'll send a few more your way if that's okay, Aaliya, because there are quite a few. But thank you so much once again. Really, really cool. And I hope you get a bit of rest before tonight.
Thank you so much for this opportunity.
Thank you. Thanks, Aaliya.